Hello and welcome to DPI's COVID-19 update, where we'll be speaking to the Minister of Health, the Honourable Dr. Frank Anthony. Minister Anthony says the ministry will soon introduce a new type of COVID-19 vaccination card.
We are going to change the card system. So we are working on that right now, and very soon we are going to introduce a different type of card. That's going to be harder to forge, and if people did not have the proper documentation in the first place, then they're not going to get the new card that we'll be putting in.
The minister urged persons to desist from such practices.
We have 110 different sites where we operate giving out vaccines, and they are dishonest people sometimes that operate in some of these sites. The majority of the healthcare workers are honest, hardworking people, but unfortunately we do have a few dishonest people among the grouping, and they're the ones who have been facilitating these cards. They are giving people cards without the persons receiving the vaccine. And as I've said before, once we get the information, we are going to get the police to investigate and prosecute those persons. We have probably about 12 to 15 cases right now that the police is looking at, and I hope that they can speedily conclude those investigations and that the persons would be charged. Because, this is a very dangerous thing in the sense that if you're facilitating somebody to get the card but they didn't get the vaccine, then when they get sick, we'll probably think that they have been immunized and we are getting a breakthrough infection when in the first place they did not get the vaccine at all. So we have to put an end to this practice, and I want to urge those healthcare workers who have been involved in this to desist, because when we catch you, you are going to face the full force of the law. And that's going to be a very, very serious thing. And apart from that, we'll probably disbar you from practicing as a nurse or, in health, because this is a really serious offense. And the persons who are buying these cards, if we catch you, you are going to be charged for tendering a forged document. So, either ways, those who enable this and those who are caught with those documents are going to face serious penalties. And I want to urge the public, if they find such things happening, to please report it so that actions can be taken. We have to root this out.
As the vaccination campaign progresses, the Ministry of Health continues to record high numbers of positive COVID-19 cases.
So over the last 24 hours, we had 106 new cases, which would now take up the active cases to 4,106 active cases. And again, Region 4 and Region 3 are the areas where we have the most active cases. We have seen a steady increase in Region 2 as well, and we have seen an increase in Region 7 and Region 10. So these are areas that we are on the lookout for. And with the increase in cases, we're also seeing correspondingly hospitalization in these different regions. Right now, we have 119 persons in hospital. We have 83 persons at the Ocean View Hospital, with 31 in the ICU. We currently have 9 maternal cases, 9 pregnant women with COVID. 6 of them, they're at Ocean View, 3 at the Georgetown Public Hospital. And the other 33 persons of the 119 are in various hospitals across the country.
Dr. Anthony says more businesses need to come on board to support COVID-19 measures.
We have to get more businesses to comply. The task force would be writing to some of these businesses to make sure that we have stronger enforcement of the guidelines because there are many big businesses that are not asking people for their vaccination status, not checking for it, and therefore there's a free-for-all in those businesses. People are walking in and out, and that's not what the regulation, that's not what the order is calling for. And unless we have compliance and everybody playing their role, we are going to have a situation where we're going to continue to have spread. So I think it's important that we get the private sector, the business owners, if everybody play their part, we are going to have a safer Guyana. But we need everybody to get involved. There's still too many persons, too many entities that are not playing that role. And I really want to appeal to them, if they have not been doing so, if they can put the measures in place to make sure that they're one of the compliant businesses that is asking for the vaccination status of the person entering the premise. If you do that, you are going to help us with this fight. So that's one. And secondly, we also want people on their own. We want to encourage them to make sure that they go out and get vaccinated, and that once they're vaccinated, they're going to be protected. There are still too many persons who are out there who have not come forward to get their first dose vaccine. As I keep repeating, we have vaccines for everyone, and we really want to encourage people to come out and get their vaccines, because without the vaccination, you're not going to be protected, as you can see from the statistics that are there in the newspapers every day. It is really the unvaccinated persons who are mostly affected. All our deaths, we have had high percentages of deaths among the unvaccinated. So it's better that you get yourself vaccinated and protected from COVID.
To date, some 608,833 doses of the COVID-19 vaccines have been administered.
So our vaccination numbers as of yesterday, for the adults, we would have completed first dose 361,626 persons who would have received their first dose. That now takes us up to about 70.5% of our adult population. These are people 18 years and above. And for second dose, we are now at 209,506 persons. That's now 57.9% of our adult population. We continue to do vaccination for the 12 to 18, and we have completed first dose 24,939 persons. That would be 34.2% of that age cohort. And for second dose, we've completed 12,762. That's about 17.5%. I can't see how it would prevent COVID-19. COVID-19, as I keep explaining, it's transmitted by, when you breathe it in, or if you take it into your mouth. But garlic tea wouldn't help at all. It's a virus. A virus can be prevented by using antiviral medication. In such a case, we have remdesivir. In other cases, there are other types of medication that has been available. And if you're vaccinated, even if you get infected, then you would get a lighter form of the disease.
This has been DPI's COVID-19 update. For more information, visit dpi.gov.gy or health.gov.gy and our social media platforms.